In this video, I discuss the gross discrepancy between the Centers for Disease Control's FluView death numbers and the CDC Leading Causes of Death reports flu death numbers, which differ by over a factor of 3. The lack of reported error bars on the CDC death counts, required by standard scientific practice, and the effect of this on the United States presidential election. The U.S. presidential election and the missing error bars on COVID and flu death numbers, November 1st, 2020. The U.S. presidential election is heavily influenced by statistics by two numbers in particular: the number of deaths attributed to the COVID disease from the coronavirus and seasonal flu deaths or flu deaths. This is a graphic with the numbers from Real Clear Politics, and it shows 230,510 deaths attributed to COVID-19. It also shows 40,905 deaths attributed to the seasonal flu. The implication of these is that COVID-19 is much more dangerous than the common cold and the flu that people experience each year. It therefore supports the lockdown policies which have devastated the global economy and severely damaged the chances of Donald Trump to be reelected as president, as well as a number of other political matters. These numbers, as you can see, are not quoted with error bars of any sort with a confidence range. Both in common practice of everyday people and in scientific and engineering practice, if you quote numbers like this, they are implied to be precise to the last digit. The general population would assume that these numbers are based on laboratory tests and other information done by the medical doctors when someone dies, and they can be certain, beyond any reasonable doubt, that these 230,510 people did in fact die from COVID-19, and similarly that the 40,905 deaths are easily attributable to the flu, which the general public may not realize is generally being used to refer to specifically the influenza virus. There are no error bars, which is required by scientific and engineering practice, and also common practice. If you give a number without giving a range or an error on it, in everyday life, you are making a specific assertion that it's accurate to the final digit. Is that actually true for these numbers? What, for example, if they had very high uncertainties? What if this seasonal flu death number should actually be about 188,000 deaths instead of 40,000? This is the absolutely most recent numbers from Real Clear Politics from today, November 1st, 2020. And it shows 236,351. Again, no error bars, implied to be a perfect, precise number, an exact count of the number of deaths. It is compared to seasonal flu deaths again, a number with no error bars, no confidence range, just we know it's 40,905. Where did they get this from? Well, here they list the CDC, the World Health Organization's 2017 numbers, whatever those are, as the source of this seasonal flu number, this point of comparison for the 236,000. Again, consider what would be the case if this is 188,000. How scared would you be? What the CDC actually does is they have a mathematical model, a theory for the number of deaths attributed to specifically the influenza virus, for which there is an influenza vaccine, the so-called flu shot, that the CDC heavily promotes. Now, the problem for them is that most deaths due to pneumonia or other causes do not have laboratory-confirmed tests for the influenza virus. Often the tests aren't done, and often when the tests are done, other viruses or bacteria are detected, such as normal, not new coronaviruses, rhinoviruses, the common cold, etc. This model, like any model, has substantial errors. In fact, here we see they give a range of deaths from 12,000 to 61,000 annual deaths due to the flu. It's a model. Let's go a little bit further. Here it is again. Deaths, 12,000 to 61,000. There's a little footnote. It says the top range of these burden estimates are from the 2017 to 2018 flu season, and they are preliminary and may change as data are finalized, even though that season was at least 2 years ago. This is the Centers for Disease Control's Disease Burden of Influenza webpage on November 1st, 2020. Now, this is where I get the graphics and information from about the missing error bars on the flu death numbers reported in the media. So this is the graphic that I showed. Estimated range of annual burden of flu in the U.S. from 2010 to 2020. And most important is deaths. Here they give a range of 12,000 to 61,000. So there's actually a large error in their estimate. Remember, they estimate the number of deaths because actual laboratory tests rarely show that people who die of pneumonia actually had the influenza virus. They claim that the tests are not accurate. Therefore, they estimate the number of deaths, assigning pneumonia and other deaths, such as heart attacks, to the effects of the influenza virus, a specific type of virus. Let me show you the table, which doesn't actually match the graphic, by the way. But this is the estimated influenza disease burden by season in the U.S. up to the present. And the final column is deaths. You see it varies, and it has a range. So the number that you see in the Real Clear Politics and other media reports of flu deaths is this estimate, which they do not identify as an estimate. They don't say that this is not based on laboratory confirmed tests that show the influenza virus is causing the deaths. This is a mathematical model, a theory, which attributes many of the deaths to the influenza virus, a specific type of virus. Now let's go down to the numbers that might be relevant to the graphic I showed from Real Clear Politics. Here, they say in 2016 to 2017, 38,000 people died, and the 95% confidence range is 29,000 to 61,000. This doesn't match the graphic. Similarly, these, quote, preliminary estimates for 3 years ago, these are preliminary estimates for 3 years ago, 2017 to 2018 flu season. The estimate is 61,000, and the range, the 95% confidence level, is from 46,000 to 95,000, well above the number shown in the Real Clear Politics purported flu deaths. And recall, scientific practice, which should be perhaps simplified but also shown in news reporting and media reporting, should be to show these error bars, to understand that this is not an exact number that you might be able to get from laboratory confirmed tests that actually showed that the person clearly died of influenza. Well, how solid are these death numbers for the flu? Clearly, a model is going to have errors, going to be issues with it. Well, let's look further at their numbers. This is the FluView website. This purports to report the percentage of deaths each week due to pneumonia and influenza. The scary red line that you see is this percent of deaths each week due to pneumonia and influenza. And it shows a number that varies from 6%, maybe just slightly under 6% in the middle of the summer, up to 8, 9, 10, 11% sometimes during the winter. The average is around maybe 7%, something like that. Okay, notice that I'm referring to these numbers well before the current pandemic. So these are numbers that were not produced under high pressure, a panic environment, a lot of chaos that we see. They should be fairly reliable. Looks pretty straightforward. 6 to 10% of deaths every year are due to pneumonia and influenza, which this website implies are flu deaths. Note that the FluView website also does not show any error bars. So the scary red line does not have error bars. The black lines represent the thresholds for an influenza epidemic. They are not, however, error bars. This implies that the accuracy of the numbers shown in this graphic is very high, that there are no visible error bars. It's below the resolution of your vision. This all seems very straightforward, that the numbers are very precisely between about 6% and much larger numbers, 8, 10% during the winter. However, these are the numbers in the leading causes of death report, which reports influenza and pneumonia as the 8th leading cause of death. Here we see the percent of total deaths in 2017 was 2%. The percent of total deaths in 2016 was 1.9%. However, a FluView website gives at least 6%. In fact, the average is around maybe 7%. These differ by a factor of over 3. In fact, the FluView website gives the raw data used to produce their graphic, which also does not contain any error bars. The CDC Leading Causes of Death gives a precise count with no error bars of deaths from influenza and pneumonia, 55,672. Since there are no error bars, these would be interpreted as indicating that the cause of death can be precisely determined and tabulated. That's common scientific practice. It's also the way normal everyday citizens who are not scientists, engineers, or medical doctors interpret numbers like that. However, the raw data from the National Center for Health Statistics used by the FluView website, which also does not have error bars, gives a number of about 188,000 deaths from influenza and pneumonia in 2017, and the numbers are similar for other years. The pneumonia and influenza annual death numbers differ by a factor of over 3. Since they lack stated error bars, these are implied to be precise numbers, which are accurate to the last significant digit. How, therefore, do they differ by a factor of over 3? And how do these differing numbers relate to the output of the CDC's model for estimating flu deaths? It turns out there's a long history of criticism of the CDC's flu death numbers. The most prominent critic is Peter Doshi, who's now a professor at University of Maryland. This is one of his earliest articles, Are U.S. Flu Death Figures More PR Than Science? This is from the British Medical Journal, the BMJ, one of the most prominent, prestigious, and respected medical journals in the world. And he seriously criticizes these numbers, showing a wide range of problems. This is his thesis dissertation at MIT, Influenza, a Study in Contemporary Medical Politics, has chapters and chapters showing many problems, very serious problems, raising very serious questions about these numbers, which he argues are primarily adjusted, manipulated, massaged to market the flu vaccine by frightening the public. This is a more recent article in the BMJ, Influenza Marketing Vaccine by Marketing Disease. So what gives? How can two numbers quoted without error bars, seemingly precise to the last significant digit, that is common scientific practice, how can they differ by a factor of over 3? I don't know. From carefully examining the language in the Leading Causes of Death report and on the website, the FluView website, this is what I think they are doing. The Leading Causes of Death technical notes uses the language, the underlying cause of death. And I'm going to quote, in this report, tabulations of cause of death statistics are based solely on the underlying cause of death. The underlying cause is defined by the World Health Organization as, quote, the disease or injury which initiated the train of morbid events leading directly to death, or the circumstances of the accident or violence which produced the fatal injury. So it appears that the leading causes of death is using this definition of the cause of death. This is the smaller number, the 2%, the roughly 55,000 number, which is fairly similar to the output of the flu model, the estimated deaths used by the CDC. However, the FluView number, the larger number, the scary red line in the graph, FluView uses the language, a cause of death. Again, I will quote, the National Centers for Health Statistics surveillance data are used to calculate the percent of all deaths occurring in a given week that had pneumonia and or influenza listed as a cause of death. It's important to understand the concept of opportunistic infection, this is a medical term, versus what I call inherently deadly infections. An opportunistic infection is an infection caused by pathogens, bacteria, viruses, fungi, or protozoa that take advantage of an opportunity not normally available, such as a host with a weakened immune system, a cause of death, not the underlying cause of death. A well-known example of this is the pneumocystis fungi, which causes a deadly pneumonia in people with a weakened immune system. Their immune system may be weakened by old age, various diseases, AIDS in particular, malnutrition, other causes. Pneumocystis fungi is common in the environment. We've all probably been exposed to it. It is probably living in some of our lungs. It's harmless until your immune system weakens due to various causes. In contrast, an inherently deadly infection, which is my terminology, is an infection caused by pathogens that can easily kill otherwise healthy adults, including young people with a healthy immune system, the underlying cause of death. It's not actually clear that such diseases exist today in the modern world. A probable historical example is the Spanish influenza in 1918, which reportedly killed large numbers of young people in their 20s who were otherwise healthy, at least according to the accounts at the time. What does it mean? Most modern-day pneumonia and influenza deaths appear to be opportunistic infections in unhealthy, usually elderly people. A cause of death, not the underlying cause of death. The influenza vaccine seems unlikely to work in these cases because these patients have a weakened immune system. The CDC has added these opportunistic infection cases to the arguably underlying cause of death cases where the vaccine might actually work to produce the large, scary numbers in the FluView graphic. Most likely, as Peter Doshi suggests, to market the flu shot, to frighten the public into buying the flu. These numbers, in FluView differ from the leading causes of death by over a factor of 3. Now, there's considerable research that the influenza vaccine is not very effective for anyone, and in particular, it may not help the elderly or very young, people whose immune system is weak or weakening due to age or other problems. What does this mean for COVID and the election? CDC death counts can have large uncertainties. We see numbers that differ by over 3 do not have error bars listed, which implies that they are accurate to the last significant digit. They do, however, differ by a factor of over 3. This is probably, we cannot be certain, but probably due to decisions about assigning whether influenza is a cause of death, the underlying cause of death, or even omitted. In some cases, this decision is likely very arbitrary, what is assigned to be the underlying cause of death. In fact, all of these numbers probably have significant errors on them because of the problems that doctors and coroners have in assigning a cause of death, particularly in cases involving elderly, infirm people who have multiple diseases, multiple problems, particularly anything that involves weakening of the immune system where they probably have multiple infections, not necessarily just one. Therefore, these numbers should have substantial error bars quoted both on the CDC website, its documents like the Leading Causes of Death report. In addition, responsible popular science news reporting and political reporting, like Real Clear Politics, should quote error bars or confidence intervals and explain clearly to the public that these numbers have significant uncertainties and any problems with estimating what those uncertainties actually are. It's not clear that we understand what those uncertainties are. It is very likely from the contradictory numbers on the CDC website that these uncertainties are very large. It may be noted that in the US and also in Italy, it's reported that the vast majority of COVID-19 deaths are persons who have other underlying medical conditions, a situation where there is likely to be significant uncertainties over the assignment of a cause of death, or in fact, it may not really be possible to assign the cause of death to a single cause. However, all of those uncertainties should be worked out and should be reported to enable proper interpretation of the numbers and how to compare the alleged number of COVID-19 deaths to the supposedly expected flu deaths or pneumonia and influenza deaths, which, as we can see, may historically be around 180,000 per year, not 50,000. The U.S. Centers for Disease Control is likely biased against President Trump for very specific reasons, not just his offensive behavior and personality. President Trump is a longtime critic of vaccine safety and effectiveness, long before he became president. As this article indicates, he's met with so-called anti-vaccine, they would call themselves vaccine safety activists during the campaign. He discussed making Robert F. Kennedy Jr., a liberal Democratic critic of vaccine safety, a vaccine czar, or involving him in assessing the safety and effectiveness of vaccines. It didn't happen, but he did do that. More recently in the COVID situation, as many vaccine safety advocates would also say, he suggested that therapeutics rather than vaccines were a better way to deal with the COVID-19. So hydroxychloroquine, which has become very controversial, is an example of an inexpensive therapeutic that would only be used by the people who are really sick, thus avoiding the risks to the general public who are not sick. Trump has a long history of raising the question of whether vaccines, childhood vaccines in particular, are contributing to the dramatic rise in autism since the late 1980s. This is a plot that I did a few years ago showing the dramatic rise in autism in the U.S. and other countries. It's risen dramatically since the late 1980s, pretty much in concert with increasing the number of vaccines required in the CDC's recommended vaccine schedule. There are, of course, a number of other environmental causes which could be causing the dramatic increase in autism. It's a complicated issue, but the fact remains this is what the numbers show. This increase has been continuing at least through 2016. It hasn't improved, despite attempts to tighten up on the broad definition of autism. If it were to turn out, and Trump is in a position to authorize investigations and studies of this issue, if it were to turn out that childhood vaccinations contribute significantly, and I mean practically significantly, not statistically significantly, but in a real practical way to this substantial increase in childhood autism, adult autism, this would be a disaster, a debacle, and a scandal for the CDC. And critics, of course, have accused the CDC of corruption, of misconduct, and a variety of other things for years, specifically related to the vaccines and autism issue. This gives the CDC a substantial bias, very likely, against Trump. And they clearly play all sorts of games with these numbers for pneumonia and influenza deaths. And they quote them in ways that are scientifically not okay. In other words, these numbers should have error bars. The errors on them should be quantified, and if they can't be quantified, that should be disclosed clearly in their graphs, in their documentation, in a way that's clear to scientists, to medical doctors, and to the general public. Let me just recap the substantial issues here. The FluView website reports, with no error bars, that over 6%, except for briefly like in July, but 6 to 10% of deaths every year are due to pneumonia and influenza. The leading causes of death report, however, reports 2%, reports 1.9% in 2016, and these are typical numbers. These numbers differ by a factor of over 3. Both sets of numbers do not give any error bars or any clear explanation of why there is such a large difference between the two numbers. Given the difficulties in actually assigning causes of deaths in any kind of situation where there's multiple causes of death, these numbers actually should have error bars. They can't actually be this precise because medical doctors and coroners simply can't always make the assignments precisely. Therefore, they should be reported with error bars. In the scientific literature, in the reports on the CDC website, newspapers, media organizations have an obligation to report the error bars or the ranges so the public can better evaluate the numbers that they are seeing. All of these practices imply an accuracy precise to the last digit, that these are perfectly reliable numbers. They are not. these numbers, such as are shown by Real Clear Politics and other news sites, political sites, have unknown error bars that are not reported. They are reported in a way which implies that they are perfectly accurate. There are no error bars, and they're given to significant to the last digit, basically. Again, that is not supported by the information that the CDC provides or these other agencies provide. They should provide error bars. They should provide, and again, the media organizations like Real Clear Politics and the New York Times should be reporting so that the public can make informed and accurate decisions about the election and many other issues. These should be reported with error bars. They are not. Our previous videos and articles on the contradictory numbers on the CDC website have repeatedly been censored by a range of social media services, such as LinkedIn here. This was a few weeks ago. This is the actual post that was censored. We've run into this with a number of different platforms. It's rather concerning, especially considering that these posts are pointing out contradictory data on the official CDC websites and documents. Apparently, it is a real threat to the society, democracy, human lives to point out obvious, gross discrepancies on government websites. You can bypass this censorship with our censored search website and service, which you can reach at censored-search.net or censored-search.com or censored-search.org. We may add additional names later, but those are the names right now. It's censored-search. Find the answers to your problems censored by advertisers and other powerful interests. It is free. We have a free version, which ranks the search results according to popularity. That is how many other websites link to the page, the search result. You can also pay and get more control and transparency into the algorithms. You can get access to more advanced artificial intelligence algorithms that look through the censored content and try to identify pages that are censored because they contain factual, true information and separate those out from other ones which are not so useful. A popularity contest cannot always do that correctly, and popularity contests can be manipulated in various ways. Thus, check out censoredsearch.com, censored-search.net, censored-search.org. This concludes this video presentation. If you like this video, please click like. Please click subscribe and the notification bell if you would like to receive more content from us. You can avoid internet censorship by subscribing directly to our RSS news feed. Please consider sharing the link by email and on your website or blog, in addition to liking, upvoting, or sharing on increasingly censored, advertising beholden, big company social media. We have encountered such censorship. Mathematical software is developing algorithms and software to automate data analysis, reducing the risks of costly errors and increasing the predictive power of the results. You can support our work financially by subscribing on our Patreon page, https://www.patreon.com/mathsoft, or scanning the QR code in the lower right corner.